Alright, so I already gathered all of my supplies at the medication cart. That is where I did my first medication check. So now I brought all my supplies up here. I'm gonna wash my hands.
The box, like 3 cards.
And I'm gonna go down 6 rights pertinent to this moment. So I have the right patient, Charles Kamang. I have the right medication, the bicillin. I have the right route, which is it's going to be an IM injection. I have the right dose, which I had to do math calculations. I did my calculations and I had them verified with another nurse. So I have 1.2 milliliters that I'm going to be injecting into Charles. I have the right time. It's 10 of 9, and it's going to be weekly for 6 months. I have the right, I want to make sure I get the right response, which is absence of signs and symptoms of infection. So then, I'm going to put that down. My second check on the bicillin. Charles Kamang, I'm checking the expiration date. It expires 2/2020. Alright, so now, to my second check, I'm going to draw up my dose. I want to clean off the top of my vial. I'm going to carefully take off the cap. I'm going to draw up 1.2 milliliters of air. I'm going to draw up the medications. A 3 milliliter syringe, 23 gauge, 1.5 inch needle. This is a safety needle, so I can pull the top down, keep it sterile. I'll put that on my tray and get some alcohol swabs to clean my patient, some gauze, and some gloves. This is where I would go back to my medication cart, do my third final check. The right patient, Charles Kamang, bicillin, IM injection, 1.2 milliliters, right time, and this is for his infection. So then I would go do my third check, lock it back up in the medication drawer. Now I'm going to proceed into the patient's room. Knock, knock, knock. I'm going to provide privacy. Hello, Charles. My name's Tara. I'm a student at HCC. I'm a student nurse at HCC. I'm here to administer your bicillin for your infection. I want to do my 2 patient identifiers. Can you spell your last name for me? Thank you. And what's your birth date? Thank you. So everything matches up. I'm going to put some gloves on. All right, Charles. So this is a thicker medication, so I'm going to administer it slowly. We're going to be putting it into your ventral gluteal site. So I'm only going to expose that area. Maintain your privacy. Alright, so I'm going to find my landmarks. I'm putting my heel in my hand on the greater trochanter. I'm palpating for the iliac crest. Fanning out my second and third finger. My thumb is going to be pointed toward the groin. So now I'm going to that area. Alcohol swab.
Today I'm going to be performing an injection for a newborn.
I'm going to put my gauze into
So I
my
get onto my card,
fourth
gather
and
my
fifth finger.
supplies, and chose my medication. Today I'm
And
going to be doing a
this is where
hepatitis B
I'm
vaccine.
going to inject.
So
this
my
here.
first check is going to be, my patient is Anton Alex.
I'm just going to
Last name Anton.
assume that this was the area I just cleaned. Now I can pull back.
Making sure I'm at a 90-degree angle and my bevel is up.
Alright. Take a deep breath. 1, 2, 3. Going to anchor it. Aspirate. And now I can slowly inject.
Today I'm going to be performing a newborn vaccine. So I would go to my cart and unlock it, and I would get out
Putting
my
the safety
supplies.
on.
The vaccine I'm doing today would
Clip.
be for Alex and
Now I
Tom,
can
and I would
put the
perform my
gauze
first check.
over
as
the
it is medication
puncture
site
site.
of
I'm
the
going to
drawer.
apply some pressure.
So I'm going to check. It's for Alex
Charles,
and Tom.
I can offer you a cold or
And
warm
medication is
compress
a hepatitis B
as
vaccine.
needed.
So I
Sometimes
have my
these
right
injections,
patient, my right
they're thicker, they can
medication.
be
My dose would be
painful.
0.5 ml on the MAR.
I'm going to
My
come
route is
back
gonna
and
be intramuscular.
reevaluate for
And I'm
the
gonna give it
correct
today.
response.
The time's going to be 9 a.m.
I don't want to see
And the reason
any
is for an infant
redness,
vaccine.
tenderness, swelling,
I'm
any
gonna
signs
use
of an
a
infection.
syringe, 1 milliliter, 25 gauge, 5/8
I'm
inch.
going to take this off,
And I would
this
document
down. I'm going to
the
cover my
expiration date
patient's
is
back
correct, which is 2020, so that's fine. And I'm going to document the lot number. I'm going to drop the medications.
I'm going to trash here and throw away all the trash.
I'm going to take an alcohol swab and wipe the top of
In
the vial.
In another normal bed, I would place him back, make sure he's
And then
comfortable,
carefully
make sure the
untap my
side rails are up, that the bed's low, locked,
And I'm looking for a
he's
0.5
comfortable, he has his
injection.
call bell.
So I'm going to pull back to inject air into the vial.
So thank you, Charles, and I'll be back to reassess
And check the air.
the area and to go document.
And the vial upside down.
So
And
I'm
pull
gonna
back to
open
0.5 ml.
open the door.
Be careful.
I'm
not
going to
share
dispose
about
of my
any
sharps in the sharp container and the trash into the trash can.
I'm going to engage the safety on my needle.
When I come back here, I'm
Be
going
careful not
to
lock it. And
document
I'll place it on my tray.
who I gave the medication
And
to,
before
what
my second check,
medication,
I have drawn up for Anton.
the right
Last name
dosage,
Anton, first name Alex.
the right
Hepatitis
time,
B,
the
0.5
right route,
It's an
his
intramuscular
response to
injection.
it.
I'm going to do it
So
today
that
at
should
9
be-
a.m. And the
that'll be
reason
all
is
set
it's an
there.
infant vaccine.